The presentation today is going to begin with a whole lot of psychological literature and research about topics pertaining to loss, grief, and the mourning process. And the way I like to think about this is that I begin the presentation talking about various theories that offer different perspectives on what healthy bereavement looks like, because it's my understanding that only if we have a clear understanding of what healthy expressions of grief and bereavement looks like can we then understand how it is that certain individuals experience a loss in some way that gets them off track or leads them astray. So we will begin with attachment theory and really get into all that body of research and writings has to offer about and how attachment theory informs our understanding of loss and mourning. We'll then move on and talk about two other theories, continuing bonds theory and the dual process model of coping with bereavement. At that point, I'll take a slight detour away from psychology and talk a little bit about cultural anthropology, actually. It's one of the major things that I ended up researching and writing about a lot in the book that I published last year. The main reason why I find it helpful to do that is because it's not only interesting to study how other cultures experience loss differently and mourn their dead in completely different ways, it also starts to provide us with some insight into how different individuals, regardless of what culture they're embedded in, experience loss in different ways and may need to mourn their loss in ways that are wildly different from others within their own community. To apply all of this to some actual clinical work, I'm going to share two case vignettes with everyone, just so that we can apply some of these ideas and not only practice how to assess for complicated bereavement, but we can then use these case studies to play with various ideas about how to help our clients design unique expressions of loss and more meaningful acts of mourning, especially if they're struggling and if they find that what culture is providing them, unfortunately, isn't helping. The first is this idea that there are incredibly distinct types of stress or stresses that the bereaved have to deal with in response to a loss. The first is what are referred to as loss-oriented stresses. These are the kind of stresses that are probably going to immediately come to mind when we think about what it means to be bereaved and what it means to mourn a loss. These are the kind of stresses that pertain to the past and the anguish that we feel when processing the loss of somebody who was once here in our life. And so loss-oriented stress is being acted on when the bereaved are crying, expressing anger, if they find themselves dwelling on the past by sharing stories, trying to patch together their understanding of what happened, of how the person became ill, and even those searching behaviors that I was talking about earlier. These kind of stress reactions tend to occur immediately after a loss. And again, the crucial distinction is that these are largely oriented towards the past. But the dual process model argues that there is a completely different type of stress referred to as restoration-oriented stresses or stressors. They are situational changes that ensue as a result of the loss, stresses that need to be dealt with just as much as the stress of mourning the loss of somebody who is no longer here. So take, for instance, a widowed woman who is mourning the loss of her husband.
There are, of course, going to be times where she is engaging in loss-oriented stressors, where she is expressing distress, dwelling on the past, maybe even finding herself compelled to act on her instinct to look for her husband around the corner and so forth. There are other times where she's going to need to contend with a very different type of stress involving things like the possible loss of income, whether or not she wants to continue to live in the home that they shared, her very relational identity, how she introduces herself at parties. One of my favorite examples of restoration-oriented stresses is that there are a lot of times where plans for the future become dashed as a result of a loss. And so the bereaved is charged with the task of figuring out, what does your retirement look like now that your husband's not going to be there with you? Or another one of my favorite examples, if the friend who always organized your social gatherings dies, what are you and your friends going to do now to figure out how to get everybody together on a regular basis if that person was the center of everybody's social calendar? Even things like how to be involved in a community, whether or not to seek out physical intimacy with somebody else, and various other ways of figuring out how to connect with family, friends, and the community in different ways. People have to adapt to new roles and new identities after the loss of a loved one. With certain holidays coming up, a lot of bereaved individuals may find that this is the first year where they're having to ask themselves, well, because grandmother died earlier this year, who's hosting Thanksgiving? That's a different kind of stress than loss-oriented stress. And there's a very important reason why we need to draw a distinction between these two types of stress. Grief rituals can help to offer people a sense that they are expressing their grief in a way that has a clear beginning and a clear ending, so that they don't feel like their entire day is consumed with a sense that they are passively just feeling the grief that's hitting them. They can make decisions about how they're going to take part in an activity, they're going to allow themselves a certain expression of grief, and then at a certain moment, they're going to end it, all with the promise that they can come back as necessary. Okay. One of the many benefits to personal grief rituals is that they can be very clinical in their design. A lot of varying answers to the question of how often do people experience complicated bereavement. The research says anywhere from 10 upwards of 20% of people are susceptible to and ultimately experience some variety of complicated bereavement. And so in those instances, our clinical goal when working with bereaved individuals who are experiencing a hard time, who are experiencing complicated bereavement, is to ascertain the impediment. We are wanting to ask ourselves why a certain individual is having a hard time mourning their loss. And subsequent to that, only if we answer that question can we answer the question of why might it be that a certain personal grief ritual is going to be of help to somebody. So let's harken back to all of the psychological literature that we were reviewing earlier in the presentation. Per attachment theory, we want to ask our patients questions, and we want to consider questions like, are emotions being repressed? Are they being, or conversely, are they being expressed in excess? Is the bereaved individual being flooded with overwhelming emotions? Per continuing bonds theory, we want to ask ourselves, are continuing bonds too present to the point where those bonds are precluding them from having any new relationships or being appropriately engaged in relationships in the here and now? But we want to entertain the opposite as well. We want to ask ourselves, are there perhaps not enough continuing bonds? And then, per the dual process model of coping with bereavement, we can ask ourselves, is the bereaved individual coping with loss and restoration-oriented stress? Or maybe what's going on here is that they are coping with one type of stress, but neglecting a completely different type of stress. And what I find often accompanies that is the question of, is the pace of mourning too slow or is it too fast?